Hello and welcome. You're watching Medically Speaking, and I'm Vaishali Sharma. With me, Professor Dr. Anup Kumar, Chairman, Department of Urology, Robotics and Kidney Transplant, Safdarjung Hospital. Welcome, sir.
Welcome. Thank you. Thank you for inviting me.
Today, we are discussing an issue that is so pertinent but seldom discussed about, and that is the sexual and reproductive health. So people are often hesitant to talk about their sexual health, especially when they have to approach a doctor like yourself. And many suffer in silence for the same reason. Help our viewers understand, sir, how important is it for a male to maintain a good sexual and reproductive health?
So, Vishali, it's very important that the males they maintain a very good sexual health in their life because it does not only affect their psychological aspect but the overall quality of life, and that affects eventually their job and their relationship with the spouse and the other family members. So sexual health is a very important part, but unfortunately in India it is often ignored. And most of the males they have a social stigma attached to it, so they don't want to come and discuss about their sexual health. They don't want to consult a proper doctor. They can go to quack, they can go to some other non-authorized persons to discuss these problems, and they often get trapped in those kind of treatment.
This
And
can
that
be linked
really
to
affect
the
not.
lack of sex ed, sir, as well.
So it is basically the lack of knowledge, lack of awareness, and this
Yeah.
not only affect them as well as their family and particularly their wife. So I mean that's really a big problem in India.
Okay. So, report by WHO on the status of infertility in India mentioned that 50% of all infertility cases are in India are due to male factor infertility, owing to the reproductive anomalies in male. So, what are the factors responsible for the dip in male fertility?
So as you rightly said, 50% of the causes of infertility in a couple is male causes. And when we analyze these causes, number one is the genetic causes. That means by birth, their spermatogenesis is defective. And as we know, it's a production of sperms in the testis that is defective. And these guys, they have different kind of immature kind of sperms in their testes. Therefore, they're not able to reproduce and produce a child. That is genetic, number one. Number two, there is a condition known as varicocele. It's like a dilatation of the veins which supplies our testes, and they get dilated, and due to which the temperature regulation of the testis is lost, and that affects the kidney, the testis, the production of sperms, and initially there is a decrease in the count of the sperms, and then they decrease in the quality of the sperms, and eventually what happens, they are not able to produce a child because of the defect in the sperms. This is number two. Number three is extreme exposure to heat. Certain occupations are like that. They have exposed to extreme heat. That also affects the spermatogenesis in the testes. Then consumption of alcohol and tobacco. That also adversely affects because it produces free oxygen radicals and which hampers spermatogenesis in the testes. Then there are certain acquired causes like infections. Viral infections, they affect the testes, and it decreases the production capacity of testes. Like mumps, it can affect the testes, and patient can have decreased production of sperms. Then there can be some surgery has been done in that area. We call it inguinal scrotal area, and that causes obstruction in the vas deferens. So he is able to produce the sperms in the testis, but the transport mechanism from testis, which takes the sperms to the urethra from where it comes out, that is blocked, and that is an obstructive cause. So that can be treated with some kind of surgical intervention. So these are some of the causes I've told, but 30% of patients have no detectable cause, and it is on idiopathic infertility, and that is increasing for the last many years, and that is something which we are worried about. And what we feel is those are the patients, they have some genetic causes, they have some chromosomal defects, and more so because of, as I said, lifestyle disease, stress, anxiety, and now even this COVID, it has affected the fertility potential of the males. Studies have been published for last 2 years. Many patients have come back with infertility problem because of COVID infection.
So that is a really pertinent point. So can you just explain a little more on the effect of COVID on fertility and reproductive health of males?
So what happens in COVID infection? We know this SARS-CoV infection, it causes generalized inflammation throughout the body. So it affects all organs and blood vessels. And we also know it also causes clot formation in the blood vessels. So
Yes,
now
sir.
what happens is it affects the sperm production of the testis, because testis is also affected by the COVID. And
Okay.
COVID virus has been detected in the semen. Earlier, it was thought that it is not present, but now it has been proved that many of our body secretions, they contain COVID virus, including the semen. And so once the virus reaches the testis, it damages the production of the sperms in the testis, and also produces inflammation throughout the tract. As I was explaining, the tract which takes down from sperms from testis, that is known as vas deferens, and it goes to the urethra. So that whole tract is also inflamed because of COVID infection, and ultimately it gets blocked. So there are multiple causes. Number one, COVID causes inflammation of the testes, causes decrease in the production of sperms. Number two, it causes inflammation of the transport route of sperms and causes blockage. So these are two main factors which contribute to infertility in males. And for last 2 years, many papers have come up regarding this.
So one other point you just mentioned about the stress, the implications of stress on the sexual and reproductive health of a male. So what can you just explain on that a bit more?
So when we talk about stress, it firstly hampers the coitus potential of the male. So they have ED, it is an erectile dysfunction. That is number one. They have decreased sex desire. Number two. And when we talk about the erectile function, it is more of psychological. So that means they have no defect in their reflex. We call it as a erectile reflex. That is normal. And when we do all the tests, all tests come normal. But when we analyze their stress, anxiety, and other things, we find that they have a lot of stress in their life. That might be because of financial problem. That might be because of some social problems, and that really affects their sexual performance. So they're not able to have good erection. So once they don't have a good erection, the third impact is early ejaculation. That means the penis does not get erect properly, and also it ejaculates too early. That is known as premature ejaculation. And that is number three. All these three further decreases their morale, their confidence, and they don't want to have sexual intercourse with their wife. And ultimately, the wife suffers, and the male develops depression. So it is a vicious cycle.
It is a vicious cycle of psychological and yes.
Male does not perform, the female suffers, male develops depression, ultimately female also develops depression. So the whole family is suffering, and they're not taking consultation for this.
So, do men with such problems with infertility and erectile dysfunction have recurring reproductive problems? And is there a cure to this, sir?
Yeah, definitely. See, they need proper, firstly, consultation with the doctor. They need proper evaluation. And as I said, whenever a patient comes to us with a problem of either erectile dysfunction or infertility, we rule out all the factors one by one. We have a protocol, a methodical protocol we follow, and we rule out those factors one by one. Eventually, we reach a conclusion that this person does not have an organic cause, and he has got a psychological cause. Then we take the help of psychiatrist also, the psychologist also, and we give them proper counseling. And it's a group counseling, couple counseling, which the wife is also participating along with the husband. And along with that, we prescribe some drugs. So definitely it is curable, treatable, provided they consult a proper doctor.
So surgeries are included as well?
So yes, I told about some of the causes which are correctable by surgery. Number one is varicocele. I told about varicocele. That is
Yes,
the
sir.
dilatation of veins which affect testes. So there are surgical techniques which are established techniques to correct this varicocele. One is the microscopic excision of the varicocele. So we use a microscope which enlarges the picture of that veins, and we ligate those veins. That is microscopic repair of the varicocele. We can also do laparoscopically, and also we can do using the corneal loop. So that is number one. Number two, I told you the storage system is blocked.
Yes,
The
sir.
transport system is blocked, which transports the semen from testis to urethra. So we
Hmm.
have techniques, surgical intervention. We can actually repair this block. So we do some test, and during that test we detect where is the block, and then we, using the microscope, do anastomosis. We excise that damaged part and we do anastomosis. So that is surgical intervention for that also. So these are two surgical things which we can perform to correct the reversible cause of infertility. But the genetic causes, and as I said, free oxygen radical, all those things are not treated by surgery. We give some medicines also, and we give some counseling also.
Okay. So, every year, about 6% of the adult population in India are infected with the, STDs, that are sexually transmitted infections and reproductive tract infections. How often should a male get himself tested for the same, and what are the tests that are recommended? And moreover, what is the best way to protect oneself from such infections?
So I will take the last question first because that's very important. We always say prevention is better than cure.
Yes,
We
sir.
always counsel our male patient who come to us that please use protection, condoms during sexual intercourse. That is number one. That is must. Number two, try to avoid multiple partners, because the more partners you have, more risk of getting the sexual infection. And that is number two. And of course, then we come to the other part of the question, that how do we treat these infections. So if somehow when we get this patient, they tell us, "Hey, doctor, by mistake I forgot to use the condom during that intercourse, and my partner was having some infection, and that partner told him later on after intercourse." So this is the common scenario. The female is having infection, male have sex with the female, and he gets infection from the female, and vice versa. Sometimes the male has got the infection, female has the intercourse, and then female gets infection from the male. So it's always a vice versa thing. And therefore, if you use a condom protection, then both are safe. That is number one. If somehow you have got the infection, we have very simple test. We take the discharge, because most of the patient have some foul smelling urethral discharge coming out from the urethra. So we do the microscopic examination of that discharge for different kind of bacteria which is responsible, like chlamydia and trichomonas. These are some of the causes, common causes of STDs in males. And of course, these are the common thing, but even HIV is possible in these patients. So if we are suspecting that patient is having a fever, loss of appetite, loss of weight, those kind of symptoms, and he has unprotected sex with some particular female, then we also do the counseling, and we send the patient for HIV test also. So these are blood tests. So they can be blood tests, they can be urethral discharge tests, which can detect what kind of infection patient can be having. Once we detect what kind of infection patient is having, then we prescribe the treatment accordingly. So as we know, for this kind of bacterial infection, trichomonas, or for the other chlamydia, we have a set course of antibiotics, and we give the antibiotic from 10 to 14 days, and we ask the patient not to have intercourse for at least for 3 to 4 weeks till he becomes all right, because otherwise he will keep on transmitting the infection to the counterpart, that is to the female. So that is the course of antibiotic we give for this bacterial infection. For HIV, we know there is a separate treatment known as antiretroviral treatment, ART, and that is a separate clinic which goes in all the hospitals, and we do the viral load testing of the HIV virus, and then we give the antiviral drugs, and we keep the infection under control. So these are some of the ways of treating this patient. But I think the most important part I want to emphasize again is prevention. Always we counsel our patient not to have any intercourse without protection.
Yes, because prevention is better than cure. So, are STDs contractable through any other factor than intercourse?
So STDs, most of the times, the most common cause is unprotected intercourse. If we talk about HIV, although this is also a kind of STD, but we know HIV can be procured if you have used a needle, which is infected needle, number one, or you have got a blood transfusion, which has got HIV virus in that. So that is, there are two methods by which you can contract HIV, which is a form of STD only, by using contaminated needle, and this happens in a group like of IV drug abusers. So they use a common needle. One of the abuser has used the needle, punctures his vein for the drug infusion, and the second abuser again use the same needle, and that's how he contracts the virus. So
So, for
this is the
example,
common.
using public toilets for the sake, I just came across the fact that it can become a cause of gonorrhea.
So most of the time, the public toilets, when we get the infection, that is not a STD. That is
Okay.
a common urinary tract infection, and
Okay.
that is not gonorrhea. The common cause is E. coli and Klebsiella. These are the common bacteria which you get from public toilets. Gonorrhea per se is acquired only by sexual intercourse.
Okay.
You cannot get it by toilets, by using the public toilets.
Okay, sir. It's a very important day today. And so, what is your message to the viewers when it comes to discussing their sexual health, considering the social stigma around it?
So I want to request all the viewers who are watching this show that please don't have any social stigma attached to sexual health. This is a part of your health, a normal health. If you want to be healthy, your sexual life has to be healthy. So therefore, if you have any problems related to sex, related to fertility, please go and consult a proper doctor. Now we have qualified doctors which are urologists. They are practicing andrology, and all urologists can see a patient who is having this problem. So you please consult a proper doctor who has a proper qualification, and also you discuss with your wife, your spouse, because she's the one which actually suffers more than you. So I will say you discuss the problem with your spouse and consult a doctor properly and get yourself treated in time. This will avoid any complication in the future.
Uh, Thank you for such an important message, sir. I hope it has been as edifying to our viewers as it has been for us. For now, I would like to thank you for your time and thank you, viewers, for joining us on this special day. Do visit our website, medicallyspeaking.in, and follow us on Instagram, Facebook, Koo, and Twitter. Thank you for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.